The question is that the proposed expenditure be agreed to, and I call the member for Higgins.
Thank you, Deputy Speaker. I may be among the most qualified people in this chamber today to speak about the health system. You see, I lived and breathed it for 26 years. The reason I stand in this House, though, is because I could not turn away from the unmet needs of my healthcare colleagues at the start of this pandemic. It breaks my heart to see what has happened to our health system, and it is thanks to 9 years of neglect, a set and forget mentality by those opposite who failed to implement the necessary reforms and investment in workforce and infrastructure. And then, of course, along came a public health crisis. And there is always going to be a public health crisis. And in this guise, it was the pandemic, and it was the ultimate pressure test. And what we are seeing now are the effects of this crisis on a health system that was already struggling but is now on its knees. Only last week in Victoria, I learned that another 20% more nurses have actually left the profession. Now, that is unacceptable. We just cannot replace these professionals fast enough. So, on the front line, I saw and heard their call, their cries and their desperation. And I heard this in Cabrini, in a major private hospital in my electorate, as well as the Alfred. And in fact, health professionals work in both those places. And that's what they do. It's a mobile workforce. We move around. They told me that they were, during the pandemic, in the early years, they were abused, they were hushed up, and they were gaslighted. And I heard a bit of gaslighting just now. And what it did was it lit a fire in me that's burned still. Healthcare workers demanded better. They wanted masks, they wanted fit testing, where the masks actually fit their face, and they wanted transparent reporting. And I reached out to both sides of Parliament at the time. And I'm pleased to say that our current health minister listened. He listened to me, he was curious, and he asked the right questions. And it was thanks to my colleagues who work in my electorate who propelled me into this House, because they knew that I know, as a first responder and as a researcher and as a frontline specialist, the pressures on the health system. I know it acutely and intimately. And their stories were the reason for the season. So in government now, I'm pleased to say I'm surrounded by like-minded colleagues. We have several doctors, we have nurses, we have a pharmacist on our side, and we get it. And I'm pleased to say that we regard our healthcare workforce and our aged care workforce as national assets, and they are. They are a national asset. They are critical to the functioning of our healthcare system. And there is no functioning of our nation without a reliable healthcare system. It must be robust and it must be supported. We are investing in 50 urgent care clinics. This is a game changer. I worked in one of the busiest hospitals in the country, a hospital that only last week our health minister described as a jewel, and it is, the Alfred. And our emergency department is just bursting at the seams. It always has been, but it's worse now. Why? Because people have deferred their care, and they are now turning up with advanced diseases, illnesses, sometimes cancers. And there is ambulance ramping, and there are people lying in trolleys. And my mornings were spent in the emergency department in damage control, basically, trying to get people out and in as quickly as possible. So those 50 urgent care clinics are going to make a real difference. It means that people can turn up with only their Medicare card. They don't need their credit card. And that is a real issue in my electorate. People are ringing my office on a daily basis asking about which clinics actually bulk bill anymore, right? And you don't need to turn up to an emergency department if you don't have a serious illness. You should be able to go somewhere else, and that is what we're delivering. But we're also investing in our health workforce with a National Nurse and Midwifery Health Service of 25 million, which is going to look after and protect this national asset. The Strengthening Medicare Task Force is fantastic. For too long, we have pivoted towards supporting hospitals, and supporting hospitals is important. But let's not forget that our primary care workforce is actually the backbone of our health system. And it takes 6 years to get through medical school, and then another 10 to 15 years to become a specialist. And so you're looking at about nearly 15 years for a general practitioner to come out. So we need to start that planning now, and we're picking up the slack and we're getting on with it. But in addition to that, we're also addressing this maldistribution of doctors from urban environments into the regions with a substantial amount of funding. Thank you, Minister.